where we'll be speaking to Dr. Khalid from Cardiff University about burns and incident prevention. So if you do have kids at home, or parents do listening carefully for some really good advice from Dr. Khalid. Assalamu alaikum, you're listening to 93.5 Unity FM. My name is Nadia, and in the studio I'm joined by Dr. Khalid from Cardiff University. Assalamu alaikum, Dr. Khalid.
Assalamu wa rahmatullahi wa barakatuh.
How are you today?
I'm fine, thanks so much.
Yeah. So we're here to kind of talk about a very important issue in the community, all about burns and prevention of burns. And you're an expert specialist in the burns unit, and you work for various hospitals. So could you just tell me a bit of background about yourself?
Oh yeah, thanks so much. Thanks for giving me this opportunity to speak with the community as well. Thanks very much. So my name is Khalid Anababta. As I just said, I'm a doctor at Cardiff University now. I'm a lecturer in healthcare school. I was actually in this country for the last 17 years, I can say. I started in 2001, been in Swindon, then I moved to Birmingham. And I'm very lucky to be in Birmingham with multicultural community as well. So I work in Birmingham Children's Hospital, and when you work with children, always you're looking for which actually may hurt the children more, and what factors and what other causes that hurting the family as well at the same time. So I've been like a theatre manager for burns theatre, and that one dealing with all kind of burns when the children coming with that injury, which is really very devastated injury, to be honest with you. Because this injury, what I found actually affecting not only the family, as well the entire family, the friends with the family, everybody. And that the other factors as well might affect, like psychological could be, social, financially, and the family ties will be affected as well there. So from there, I have discussed with a lot of colleagues, doctors, nurses, everybody working with me, to see what I can do, actually, what we can do to have research, maybe to see what are the incidents and mechanisms that affecting childhood burns, and plus thinking about family experiences as well. So from that one, I decided to do my PhD about this topic. And since that moment, I collecting data, and that one, a PhD study, which is take a long time. I've done my research, which is like maybe collecting data by questionnaire, and at the same time, I have done interview with these families actually when they bring their children with this injury, and to talk with them about their feeling, about their experiences, and the most important thing in my research, which is the mechanism of that burns. And I found eventually in my result, which is we can get rid of these causes. So it's easy, we can avoid them. It's easy preventable. And that's why my research as well, and I published many papers for that one, and presenting my research as well in many conferences as well.
Inshallah. Be very interesting to have a read through your research as well, and kind of what data
Thank you very much.
That you'd find. Now, talking more about families and children. So, in your years of working at hospitals and being around kind of young children that have come with burns, how do you think that's kind of affected them for the rest of their life?
Well, to be honest with you, when you find like the integrity of the skin, first of all of us, we want to see our children, they're growing up in a very good shape, and mind, body, everything with them to be like in a good shape for the future. And this, we all looking to our children like that, and maybe as well other children we want to see in this one. Thankfully, none of my children have any problem like that. But when you're looking for other children and you see how the family feeling there, how they are crying sometimes, how they think that they lost something in their children there. But what we're trying to do, actually, why we're not preventing that one? We can prevent. We can do something to prevent that one by increasing awareness of the community, by talking with these people about other people's experience as well, to learn from other experiences. And definitely, to be honest with you, you find that one, if we go financially, first of all, which is maybe the last bit there, but talking about financially, if the lady or his mum or the child's mum working, she will stop working straight away because she has to take care of the child. Now, all the family depending on one income could be. So that's one financially. Then she has to be in the hospital all the time because you have to visit and revisit and visit and revisit again. I know one of the burns took like 2 years. 2 years, I know the family there, they coming and going. And you see maybe every week, every 2 weeks, every 1 week. And sometimes operations, sometimes coming for a visit, sometimes for changing dressing, sometimes for advice and so on. So see that one, only 2 years only for treatment. And what about the consequences after that? Psychologically now. So they have to live with their psychological problem. Some people, they feel stigma. Some people, they feel with other things as well. And to be honest with you, I can say that it's a big issue. It's a big issue for the family. It's a big issue for the family. If you look for social as well, as we said, if maybe other people, they don't want to show their children to other people who got burns and whatever, sometimes they leave the area. Sometimes they move for another place to live, or sometimes they hide their child. They're not sending their child for the same school. They're not letting their child to play with the same friends he grown up with. So a lot of things happening there. So you can say psychologically, socially, financially, family ties, all that one will be affected.
So kind of psychologically, it can really affect an individual, the child and the child's family.
And the child family and his siblings as well could be affected,
So if we look more about how can parents at home that have got kids, what measures can they put in place in their family home to prevent incidents like burns kind of taking place? What measures can they put in the family home?
That's a very good question, to be honest with you. Thank you, sister, for this question. But first of all, I believe, let us speak about factors, first of all. Factors that causing burns. And then if we know the factors, we can avoid them easily. So factors like maybe, we know some communities here, because we are multicultural, so you find people actually they have deep frying like for their food. Could be like when they do curries, when they do something like that, they deep fries, and you find the children playing around and whatever. So definitely, if you have a deep fries and large one and a big one, you can't control all the area around that one. So maybe if we want to do and work on that deep fries, could be like in a separate room. Could be like that, or maybe avoid that one completely to protect my child and other children. You could like overcrowded sometimes. When you cook, when you do something like that, when you do cooking or something, you find like a lot of children around you. So why you have children around you at that time? So when you do cooking, leave the children away. Let them play somewhere else under supervision as well with other area. And then less supervision, I see that one. Sometimes actually they allow the children to do whatever they like. When I've done my interview with people there, I got many people there. They're saying, from now on, we are like a police in the kitchen there. We not allow anybody to come in. We not allow children especially to come in. Because, especially when you talk about England where we live now, we have like small kitchens. Lots of houses, they have small kitchen. Small kitchen, in my definition, on my research, I define that one is the kitchen that allow only one person to move inside the kitchen there. So if you have a lot of children going in, and you are as well, you do cooking and so on, so a lot of children there, definitely you can't control the hot things around. And they found that maybe, which is the major one I found, the cause of the burns the majority come from the scalds. And because of that one, 70% of the children, they have like spills or scalds. So what happened with these children now? When you come from work, let us to say, you have like dining table. Hopefully everybody got dining table at the moment, and the cloth. Usually they bring the cloth like was dangling from the side there, maybe half meter there. So at 2 years old, 3 years old, what he has to do? Sometimes he catch this cloth and take it to his side. Now, what happened over the cloth there? You have like hot soup, you have like a cup of tea or coffee or whatever. So then what happened? So when the child take that one to his side, all that one spilled his body. And now you will be, instead of enjoying, now you have to take your child to A&E, you have to stay there for a longer time. And sometimes, as well, the people, they're scared from something called maybe like abuse. So you're going for a question of abuse as well, maybe.
Yeah.
Why happened that one to your child? Or maybe they're questioning you. They say a lot of the question come from the A&E, from the doctors, from the nurses, from the social services working there. So all these people, they try to find out what are the causes and what happened to these children. Sometimes as well, they found maybe there's a relationship between the people if they can't understand the instruction, or some people, they can't understand the instruction, sometimes for the language, sometimes for the culture, sometimes for a lot of things happening there. So now, if you go for the measures, the question now, we come for the measures. So supervision is very important. I want to supervise my children. I can't let my children to go for dangerous places and I say, oh, the things happen now. But from the beginning, you can avoid that one. So by supervise your children. Cloth in the dining table, as I mentioned. So why we're not having cloth at all while we're having our food, or maybe we make it smaller or on the size of the borders of the table. Number one. Keep children under supervision all the time. And then fire alarm. I think we discussed this one before. Yeah. Sometimes actually when I buy a house, I found the fire alarm there. But when the battery gone, so I'm not going to change the battery. So now, where's the fire alarm for that one? So you have to think about that one. Something very important as well about the cooker itself. Usually the people, they put the saucepan, the fire, they put them where? On the front burner. Yeah. We advise them actually to take it to the back. To get to the back all the time. Very important. That's mean the children, they can't reach that one. If they allowed to come inside the kitchen, which is, we said at the beginning, not allowed to come in. Yeah. So all that one is important as well to prevent. And there are other things, but for limited time, this is what I can say at the moment.
Yeah. So there's other things like hot iron that, because a lot of mums and dads are ironing the kids' clothes while the kids are running around in the living room or whatever. So that's maybe, and the iron comes with like a long wire dangling as well into the electricity port. If a child comes and kind of just pulls the wire down, and the iron can fall on them as well. Kind of hot water as well, when the child's having a bath, especially the young children.
It's not only the iron as well. You have the burner, could be. You have the as well, the straightener. Yeah. We have burns for that one come for the finger. Sometimes the child put the straightener in his finger or her finger, and then or her hands, and when they come in there, sometimes deep burns. You know what we mean? I might just define that one. You have like 3 types of burn. You have superficial burns, you have second degree burn, and you have third degree burn. The superficial burns, which is sometimes you feel like redness a little bit for that one. The second degree burns, which is going to the layer of the people actually in the medical field, they know that when they go for the second layer of skin, which is the dermal layer, and that one, sensation, blood vessels, everything will be affected. And the third degree burns, which is severe burns sometimes, when they go deeper and deeper, sometimes reach the bone. Yeah. So we don't want our children to have all of that one. We can prevent that one. Yes, there are a lot of cases, incidents, it will happen. Yes, we agree that for that one. But I mean to minimize as much as we can. How to minimize? We supervise our children. We take care of them. And the advices we take from the leaflets, sometimes advices from the TV, speak with other people about it. All that one is very important. Yeah.
Is there a particular time of the year where hospitals see more burns happen in a different part of the year?
I agree with you, actually, because people sometimes they think winter more because burn are there, because you have everybody at home and whatever. But to be honest with you, my research, because I've took it for 1 year, 1 whole year, I found actually no difference at all. Yeah. But there is something important which is I found in my research. Number one is the majority of burns happening early morning and late afternoon. Okay. And I want to see why this one happening. Then when I've done the relationship between burns and maybe working family, burns and employed family, and they have occupation already, you found that the majority of the people, when they wake up in the morning, they have a cup of tea and whatever they do that one. At the same time, they prepare their children for the school. Yeah. And where is the burns happening? And afternoon, when they come from work, they do a cup of tea or coffee or whatever, and then the same thing happening for their children. So the majority happening, and there's a peak value as well. Early morning which is, we can say, early morning from 7 till 9, and then I found in afternoon between 3 and 5. That's the majority burns happening in that area. I can't say every burning, but the majority of burns happening at that time.
Yeah.
At that time.
Thank you so much for coming in today and talking about burns. Is there anything you wanted to add before you leave?
Well, what I try to say, actually, we all have our children. We all need our children to grow up in a good way, in the manner we're looking for, in the way, on the shape we want to see them. So please think about your children all the time. Prevention is better than cure. We all know that one. So please, if we know about the factors that cause burn and how to avoid them, and why not we are working like, because these children, actually, they are vulnerable. We have to take care of them. So we are adult now. So I think we try to think for all the possible available things around us, all the measures. Think about it. If your alarm not working, fix it. If you do your cooking in the front burner, take them to the back. If you have long wire for your iron or whatever, make that one short and make it available for you only. Take it to the other place, safe place. Do your ironing in other place, safe place. Don't let other children to come inside the kitchen. So all these advices, I hope everybody actually may think about them and to minimize the incidences of the burns. Okay. And thanks so much.
Thank you so much, Dr. Khalid, for coming in to speak to us. It's a very interesting topic and some great advice there. Jazakallah khair.
Thank you very much. Thank you very much. Welcome.
So there we go. That's Dr. Khalid talking about incident prevention and his experience in the burns unit in hospitals.